I'm Austin Andrews with your Beacon. Today we're taking a look at the health crisis. The food industry wants us sick and addicted. As the Make America Healthy Again movement has begun to take hold, experts have formed a coalition that spans political party from Robert Kennedy Jr., the lifelong Democrat, to the MAGA Republican and former President Donald Trump, and to the liberal Jillian Michaels. Experts are coming together to discuss these issues in wellness in America and encourage solutions. Now, I don't know who Jillian Michaels is going to vote for when it comes to president, but the fact that she joined Robert F. Kennedy Jr. and Jordan B. Peterson at a health crisis roundtable to agree on the need for the United States is a big deal. Another couple of experts who have raised their voice to this issue is Casey and Callie Means. Casey, the surgeon, the medical practitioner, shared in our last episode about her leaving the surgical ward to actually help people with root causes. But today we're going to be focusing in on Callie and his experience in politics and in lobbying.
Casey was a bit smarter than me on the biology route. I wanted to be contributing to politics from an early age and went to Stanford to go back into politics, studied economics, political science, went straight back to campaigns after school. What I learned quickly is that then campaigns over, you work for the biggest spenders in DC, and I found myself across the desks from food industry and the farm industry. The farm industry spends 5 times more in DC than the oil industry. But starting with food, I learned early on that the food industry, and this is my construct, the food industry and the processed food industry was created by the cigarette industry. And I think this is very telling. It's something I learned. So in the 1990s, the 2 largest food companies in the world were R.J. Reynolds and Philip Morris. What happened is when the Surgeon General way too late in the 1980s said cigarettes were maybe problematic, these were some of the largest companies in the world with the largest cash piles of any company in the world. So what they did is they used their cash piles to buy food companies. We think about the 80s as the Wall Street era M&A, a lot of deals. The 2 biggest M&A deals up until 1990 in world history were cigarette companies buying food companies. So you had in the 90s, these 2 cigarette companies very strategically do 2 things. They shifted their thousands of scientists who were experts at making cigarettes addictive to the food department. So we had the rise of ultra-processed food where our food now is a science experiment. The second thing they did is they shifted their lobbying. So the cigarette industry, of course, was the biggest, lobbying spenders and had a good playbook. They shifted their playbook on lobbying and rigging institutions of trust to food. So they created the food pyramid. So the cigarette industry, through the food companies they bought, paid off the FDA, the USDA, Harvard to create reports saying sugar doesn't cause obesity. And they lobbied for the food pyramid in the 1990s, we all remember, which said, animal-based fats are bad, carbs are good. Remember, carbs and sugar were basically the base of the pyramid. So the American diet, because of that, because we trust our medical institutions, which they know, we shifted our diet significantly to ultra-processed food. It was very intentional, the food pyramid. That was a ultra-processed food marketing document that carbs were fine, sugar was fine. And that shifted, and you look at dietary patterns. Today, a child diet is 70% ultra-processed food. Now, what does that mean, right? Those are literally foods invented by the cigarette industry to addict kids. Obviously we've got sugar, but there's thousands of different ingredients and science concoctions that scientists work in a lab to make it more palatable, to make it more addictive. So food consumption, calorie consumption has skyrocketed. And the byproduct of these toxic ingredients that the cigarette industry I watched and helped with this, bought off the USDA, bought off the FDA, is they wreak havoc among our cells. The foundation of our diet is ingredients that we aren't biologically made to eat that didn't exist 100 years ago. The foundation of our diet is 3 things when you look at any label. It's added sugar, processed sugar, which basically didn't exist 100 years ago. It's just from natural sources. Ultra-processed grains, which were invented 100 years ago. The processing takes the fiber off. They're basically hidden sugars, devoid of nutritional value. And seed oils. Seed oils are the top source of American calories. And this is actually...
Seed oils are the top source of American calories?
Soybean oil, canola oil. This is the baseline of American calories right now. And these seed oils were actually created by John D. Rockefeller as a byproduct of oil production. It's basically engine lubricant. And the Rockefeller and those aligned with him actually lobbied to have this suitable for human consumption. That's how seed oils came into the American diet. They're much cheaper, but they're highly inflammatory. And just by definition, just at the highest level, these ingredients and all the chemicals we can't name that are in ultra-processed food are not natural ingredients that our bodies are made to handle. So there's, as we talk about in Good Energy, this produces a lot of side effects to our cells. The food industry isn't trying to kill Americans. They're trying to make food cheap and addictive. And what I learned, in the morning meeting with the food companies, trying to lobby and influence the USDA, being the lifeblood of nutrition research, paying off, nutrition research at Harvard and Stanford as a junior employee, shocked by that.
So you saw that?
Oh, my first week, as working for these industries, it was a list of top professors. And the food industry pays 11 times more for foundational nutrition research than the NIH. You go to any nutrition school in the country, the lifeblood of their school, they'll proudly admit this is from the processed food industry. In the past 2 years, there's been 50,000 peer-reviewed research studies on nutrition. We're the only animal that has peer-reviewed nutrition studies, and we're the only animals that are systematically obese, diabetic, and being crippled by metabolic dysfunction. We're born with an innate sense of knowing what's right for us. The problem very strategically, and this is well known among the industry, is that ultra-processed food does, because they're able to do this science experiment with our food, it hijacks our biology, it hijacks our satiety signals. High fructose corn syrup, fructose, it makes us want to eat more. Because in the wild, when you see a bunch of fruit out there, you're well advised to eat it, historically. We've basically rigged our biology to hijack our signals that, make us satiated. So that's what ultra-processed food does. So that's the food industry, okay? The food industry actually, with their own set interests, want to make food addictive and cheaper. It kind of makes sense. The criminal devil's bargain is that it's highly tied to the healthcare industry. And as Casey said, the fastest growing industry in America right now isn't AI. It's not tech, it's healthcare. It's the largest and fastest growing industry. And just as a statement of economic fact, the best thing for that industry is a child getting sick. When a child gets sick, or any American gets sick with a chronic condition, with diabetes, obesity, kidney disease, heart disease, whatever, they go on a lifetime medication. They go on the metformin. They go on the statin. They have lifetime treatments. And they keep racking up more comorbidities. If you're diabetic, you have an average of 4 other comorbidities. So you keep racking up, but you don't die. You just suffer. You inevitably get infertility, depression. You start racking them up. So that's very good for the medical system to have these chronic conditions that need to be managed. Just from a pure economic standpoint, that's how the system's set up. That's all happening largely because of our food system and other metabolic habits we can talk about, but largely because of our rise of ultra-processed food that's really, really hacking our cells and really hijacking our cells. The criminal part, the devil's bargain, is that the healthcare system, you'd expect to be speaking out about why we're getting so sick, but they're not only silent on the reasons, they're not only trained Casey the first day of Stanford Med School that we're basically taking it as a given that people are lazy and going to get sick, we're just going to profit from treating them. They're silent on that, but they're actually complicit. Working for Coke, I helped steer money to the American...
Coca-Cola.
Yeah, working for Coca-Cola, they actually pay money to the American Diabetes Association. They actually pay money to the American Academy of Pediatrics. If there's one thing the American Diabetes Association, which sets the standard of care for diabetes management, should be doing, they should be saying, we're not going to accept money from Coke, which is diabetes water. They accept money from Coke. So there's
that's like Tyson Chicken subsidizing PETA.
Right.
Realize Callie is alleging from personal experience that Coca-Cola is paying the American Diabetes Association. And that because of relationships like this, instead of health organizations speaking up about what is best for patients like you and I, they are actually being silent as food industry products are injuring the population. How much further does it all go? We'll learn more tomorrow. I'm Austin Andrews, and I'll see you in the next report.